Welcome to the second P&G Ventures Innovation Challenge. We're excited to have you here. P&G Ventures is an internal startup studio within Procter & Gamble who is partnering with visionaries, startups, entrepreneurs, and inventors to create new brands and businesses in categories where P&G currently does not serve our consumer. Here, watch this video and learn a little bit more.
PGV is an internal startup studio within Procter & Gamble, and our purpose is to be able to partner with entrepreneurs who have great ideas within the key categories or spaces that we're looking to work in.
You know, as we work with entrepreneurs, one thing that P&G Ventures brings is all the infrastructure that comes around with P&G. Everything from supply chains to R&D, regulatory, branding, communication, endorsements, things like that, because we have been around 180 years across many, many categories, we have a lot of relationships and a lot of skill base that a startup may not. And making that accessible to entrepreneurs is really where we think the magic happens.
Procter had all of the capability necessary, this deep and comprehensive expertise in doing this consumer product development. And so one of the things that happened in this partnership is they were able to help us understand where are the gaps. We as a team started to recognize the gaps, and then they leaned in with intense level of expertise to start to fill those gaps.
PGV brought in so many great resources for us, and they just supported us through the whole thing. They had specialists that knew exactly what to do. It was really incredible, and it just took everything to a whole new level, somewhere we didn't think we'd ever get.
There's a lot of stuff that we've learned how to do well because we're great at it or just because we failed at it. And there's a ton of things that entrepreneurs just shouldn't have to learn if they've got the right partner. When it comes to filing patents, when it comes to regulatory navigation, when it comes to how do you sell into a Home Depot or a Target, that's stuff that we do every day.
Well, without partnership, I don't think we could achieve changing the market. It's just not marketing and getting into retail, and it's just not technology that really works and solves a consumer problem. It's the marriage of the two.
One thing I love about this job is watching dreams come true for entrepreneurs. They have passion and energy, and they are determined to solve a problem for a consumer. And a lot of the issue sometimes is the how. And being able to see the products on shelf and see it in Target and Walmart or online, seeing those dreams come alive for those entrepreneurs and for P&G Ventures together as a partner, that makes for a good day.
So welcome. So let me tell you a little bit about the Innovation Challenge. The P&G Innovation Challenge, PG Ventures Innovation Challenge, just started last year, and it was so successful we decided to bring it back again this year. This year, we received 3.5 times the number of applications or the submissions as we did last year, and they were better than before. So good that we couldn't narrow it down to our initial 3 of desired, and we have 4 really great guests here today pitching their products and their ideas. We are joined by some great judges and some great partners. The winner will win, well, they all won the opportunity to come here and pitch. We sponsor their travel here. They'll win a $10,000 check. They'll win a complimentary invitation to the EY Strategic Growth Forum, and they'll win an opportunity to be in the Techstars Accelerator. So we're excited to join you here today. First, let me introduce our judges. First off, we have Lee Radford. Lee is a 20-year of delivering significant and sustained business growth across multiple P&G categories. Lee's passion and talent for taking small ideas and promising and turning them into proven global brand success led her to create the P&G Ventures Group. Next, I have right here is Carol Faig. As EY US Health Leader, Carol is responsible for driving the effort to help clients navigate rapidly evolving health ecosystems, specifically in the areas of convergence, growth, digital, regulatory compliance, risk, policy, and cost optimization. Next, I have Julie Setzer, VP of R&D of P&G Ventures. Julie is currently the charge of innovation capability at P&G Ventures. In this role, Julie has responsibility for identifying the best internal and external innovation practices and scaling them across P&G to accelerate growth through innovation that truly delights consumers. And last, I have David Brown. David is a founder and CEO of Techstars. He has a 30-year career starting and building sustainable companies, including Pinpoint Technologies and Techstars. Thank you for helping me welcome these great judges. Now, I'd like to invite up to the stage Richard Hambury. Richard is the founder of Sana, a neurological wearable for the control of chronic pain, addiction, and anxiety. Thank you, Richard. Here you go.
Thank you very much. Morning, everyone. This was me in 1992. A couple of hours after this photo was taken, I was forced to drive that Jeep off a bridge in order to avoid a head-on collision with a petrol truck. I went 60 foot down into a dry riverbed. As you can imagine, that Jeep crumpled up like a Coke can. That resulted in spinal injuries, THC10, and a severed aorta, or torn aorta, which bled internally for 5 days. I was flown back to the UK. I was clinically dead for 8 minutes, came back from that into a coma, came out of that. And eventually all of that led to a nerve damage pain problem that gave me a 5-year life expectancy. And the standard of care back then is the same as it is now 27 years later. Hasn't changed. Starts with opioids, goes on to other drugs like gabapentin, then implantable devices, TENS devices, and eventually when everything else fails, they say, hey, have some meditation, try that. Now, my meditation ability was 0. My pain levels were 20 plus on a 1 to 10 scale. And watching a movie, it put me into a flow state that changed my pain levels more than morphine. So I was like, okay, there is something here about changing state of consciousness that will allow me to address my own pain. So maybe I need to develop something that I can actually produce that meditation from the outside in. So I started looking at what does a 20-year meditator's brain look like. And luckily for me, there was already 50 years of Western medical research by that stage into what brains look like on long-term meditators. And there was one guy in particular called Maxwell Cade who wrote a book called The Awakened Mind. And it basically, what you're looking at is left-hand side of the brain and right-hand side of the brain, and electrical activity. And what it showed is that long-term meditators have very specific frequency patterns that always show up. And really importantly, a total balance between the left and right-hand side of the brain. So I read that and I thought, okay, great, that's a really good blueprint for me to go after to try and create something to create that effect. I measured my own brain on a very similar symptom, and I looked very much like that picture on the left. So huge disparity between left and right-hand side of the brain. And what I didn't know at the time is that's almost everyone with chronic pain and chronic anxiety. That disparity is the root of a very large number of problems. Now, with the earliest prototype of the device, I was using it 15 minutes at a time, multiple times a day. And quite quickly, I got to something more like this, with a balance between the two sides of the brain. And then over 3 months, that removed all of my nerve damage pain completely, and I haven't had a single nerve damage pain minute since 1993. So if I superimpose that original picture, that's what we can produce with the device over a long period of time, repeated use. And this is how we do it. So it's using pulsed light and sound to trigger very specific frequencies in the brain. And because we're going through the visual cortex and the auditory cortex, it means that unlike trying to use magnetics or electrics, we don't have to go through the skull. We're actually using the brain's own system for getting information in, to get information in that we want. And then this is a current version of the device, and we are actually measuring the effect of that with a heart rate variability sensor on the forehead, which allows us to personalize that treatment to anybody who using the device. So once I'd fixed the problem for myself, I started going, oh, well, okay, who else can I help? 59 million Americans suffer from chronic pain. Most of them are using opioids to try and get through a day. 71,000 opioid deaths in 2017. Opioids don't work very well for long-term chronic pain. The market is huge. It's a $30 billion market for us alone, based on who we can help and how much revenue we could get if we could help all of them. Within the major areas of pain, we've got anecdotal data in all of the areas, but the one where we've got the strongest clinical data is fibromyalgia. That's like spinal injury pain because you've got the brain amplifying the pain signal. That's 80 to 90% women, and the biggest drug in fibromyalgia is Lyrica, which sold 4.9 billion last year, and it's the most effective drug, and only 20% of people use it because of how severe the side effects are. We've got a 3x larger impact on improving people's lives than that drug, 3 times. So because we're using light and sound to change patterns in the brain, and we're doing it in a very gentle way and a very effective way, we can affect depression levels, anxiety, multiple types of pain. We've done a lot of work in sleep and helping insomniac sleep. We're at-home use, low cost, and no major side effects. We're essentially meditating from the outside in. We've done 4 clinical trials so far. The most important one was the fibromyalgia, and again, we got this 45% improvements in symptoms against best standard of care of therapy in 2 weeks. And we got a duration of effect that when we checked at 6 months, we were maintaining this use case, these results. Now, this started with people using for 15 minutes, 5 times a day. And we told people use it whenever your symptoms are too much for you to enjoy whatever you want to do. So whether it's fatigue, anxiety, depression, or pain, use the device if you can't enjoy your day. At 6 months, people were using on average once a day, and their pain levels were down at 2 or 3 out of 10 rather than above 6 out of 10, which was the criteria to join the trial. And then with anxiety, total of a 46% reduction. That's a lot better than Xanax, and it's instant, and there are no side effects. 49% reduction in depression. That knocks Prozac out of the park, and again, no side effects. And a pain level drop across everyone who used the devices, responders and non-responders, at an average of 20%, which is really good compared to any drug in the market. I hope you can hear this.
Hi, I'm Alejandra Borja, and I've been suffering from fibromyalgia for the last 15 years, including severe sleeping difficulties. For the last 10 weeks, I've been using Sana, and I can tell that Sana changed my life. I can sleep 6 to 7 hours each night, and it has improved my quality of life. And I want to thank Sana, because this is a big difference. Thank you.
So here are some more of the responses from people who were in that trial. This bottom one is my favorite, because this is really what it's all about. With chronic pain, it's destroying your life, and we want to give people their lives back. It's what we're all about. Business model wise, the most important things here, we are looking at a $50 a month subscription after 1 month of people being able to try the device for free without any upfront payment. And if we can get 2% of sufferers, then we're at 100 million ARR. Our go-to-market plan this year, we've got one large reimbursement study happening, which goes basically to reinforce the results we've already got, but also to look at the health economic impacts of that change. And then we're doing a partner rollout starting in April. And this first 1,000 devices is so that we can get every part of the patient and customer experience nailed down perfectly. And to do this, we are partnering with Anthem to do that first 1,000 devices. We've also been talking to Walmart already, and we're also looking at how we go direct to the consumer. We are actually demoing in the AARP booth next door, so come and have a demo later. And the Mighty is a very large patient group. And again, 10 million people already diagnosed, another 5 to 10 probably undiagnosed. And that's just the start. I'll come back to the business model in the questions if you have them. But looking at other types of pain, we've already done opioid use disorder trial successfully. We've got a neuropathic pain study starting at Mount Sinai, Cleveland Clinic on multiple sclerosis, and then lower back pain, that's at Walter Reed. The team, me with 25 years of experience on the technology, a COO with med device, long-term experience, commercial officer who launched Prozac and Nicorette, and a CFO who's got a very long experience in medtech as well. We added a lot of partners at the end of last year, courtesy of Mass Challenge and NATO. But really, it's all about the patients. So this was the first person who I was able to help with a standalone device, because that was the big disparity. The original device was laptops, boxes, wires, EEGs, and it took me until 2015 until the technology was available to make a device that could stand alone on its own. The very first pain person who used it other than me was this girl called Hattie. And she had chronic regional pain syndrome, which made the skin in her arms so sensitive that she couldn't touch it for 3 years and was out of school for that whole time. First use, she was able to touch her arm without crying, and then was back at school. So it's helped hundreds of people like Hattie already, and obviously it saved my life. And our aim is by the end 2030 to get to the 1.5 billion people who suffer from chronic pain or anxiety and provide them with a solution. And obviously to do that, we need a very large amount of help. Manufacturing, distribution, we've got the technology worked out, but we need help in actually then scaling that. So thank you very much for your time.
Questions?
Yes, great presentation.
Thank you.
Can you talk a little bit more about the regulatory path that you're seeing and some of the biggest challenges you see ahead on getting this to market with the claims?
Yeah. So we're going through as a de novo on fibromyalgia first. We've also got a de novo plan for the anxiety indications. Every other indication after those two will be self-predicated 510K, so they become quite quick. We've already been given a designation as a non-significant risk device, which means that early this year we're actually going to apply for 513G, which is a consumer rating, which we can then go to market with that consumer device, just not making medical claims until we've proven their medical claims. So we don't really have much regulatory risk. We only have risk around when we'll be able to say specifically treating fibromyalgia, specifically treating insomnia. But at the moment, we could go to market tomorrow saying we can help you sleep better. We don't want to do that. We want the medical credibility first, and then to go downhill into the larger consumer areas. But we want to start with the people who've got the biggest problems first, which are the medical side.
Thank you.
Great presentation, and thank you for sharing the personal story. I think it's
My pleasure.
very, very powerful. My question is sort of in getting this out to market, what's the biggest rock? Is it regulatory? Is it manufacturing? Is it distribution? What's the biggest challenge?
It's distribution. The manufacturing side, we have the expertise. It could be done quicker and better with more help, absolutely. But we know it can be done. We just know with a lot of help, outside help, we could do it faster and better to scale. On the regulatory side, we've got it worked out. It's really a matter of time. Where the real challenge is on the distribution and marketing side, because once we can get word out. So on the clinical trial of 20 people with fibromyalgia, we got 80 inbound direct inquiries from those 20 people using a device. So we know that once we can get that into hands of people who really need it, the effect is so large that will snowball. And then how do we actually manage that degree of growth that we could actually have? I mean, the 40 million in 3 years, I think we could actually blow that out of the water if we had the resources to manage that upswing. If we can get those initial people using who really need it, they will tell people, and then we've got a problem of how do we actually deliver. So when I think about it at night, what worries me is, one, how do we start that going? And once it's going, how do we then actually deliver on it? And that's what we haven't got the resources to do yet.
One quick question for you. Talking about the sensor that you said was in the device itself, so are you modifying based on the patient's reaction, sort of the pulsing of the lights and the process their brain is going through?
Yeah, so we've worked out how to improve those feedback loops based on the individual's response. The clinical trial data at the moment is just on the very base layer that affects everybody. But we know we've got about an extra 30 or 40% efficacy we can add on top of that already. But we're not allowed to turn it on until we're through that first FDA hurdle, because they want the same treatment length of time for the sham versus the active in clinical trials. But we know it works really well because I worked all of that out on the EEG. And the great thing about heart rate variability is it gives you a proxy for exactly how relaxed someone is. So we can tell which of those programs on the device is actually relaxing you the most in the moment, and then concentrate on those. And that's what it used to do manually with EEG, and that's what we couldn't replicate until the technology advanced to the stage it is now, where we could use sensors to counteract that.
Thank you.
Any other questions? I think.
Can you talk a little bit more about the IP that you have behind your product?
Yeah, certainly. So I had really good IP advice very early on because I've been at this a long time. But someone said to me early on, don't file anything, don't sell anything, don't publish anything until you have a business model that's scalable. Because otherwise your time will run out. If you haven't got the technology to launch, don't do it. So we actually filed all the IP in 2015. We had our first patent issued in June, which covers the combined use of light and sound on anything neurological.
Wow.
We then have a second patent, which is on the feedback loop that affects those underlying patterns. And the third one was the most interesting one, which is the pain patent, which covers any rhythmic use of light or sound or the combination. No one's looked at how to use light or sound, let alone the combination, to solve chronic pain. So that's actually our broadest patent of all. But the first patent covers almost everything neurological with the combined light and sound. And then we've got a fibromyalgia one, and an opioid use disorder one, and an anxiety one. And all of those also have
I got it.
the broader light and sound combined.
Thank you very much.
My
Beautifully
pleasure.
done.
Thank you very much, Richard. Great story, great product. Thank you. Everybody, the moment has come. I do not know the answer, so I am equally as excited as you are. But I would like to invite Lee Radford up the stage, the VP and General Manager of P&G Ventures, to announce the winner.
Hi, everyone. Wow. Am I on? I just have to say wow to all four of you. It was an amazing discussion in the back. I also want to thank the judges. You know, we were talking about having the perfect blend of judges from both healthcare, startups with Techstars, E&Y in healthcare. And so it was really a robust discussion and not an easy one to make this call on. So we look forward to conversations with all of you going forward. But we had to pick one. And without further ado, we would like to congratulate, is it coming up? Richard Hanbury, Sana.
Thank you very much.
So Richard, it was congratulations.
Thank you
It
very
is
much.
so exciting to extend this very large check on behalf of P&G Ventures and all of our partners and judges. A fantastic presentation, fantastic story, and a big problem that you're looking to solve for millions and millions of consumers. So without further ado, we want to get a little photo credits and a big thank you to the other three. We look forward to joining you for lunch later on. And an amazing, amazing innovation challenge. Thank you very much.
Thank you. And thank you too.